over gloves. So you're going to do your 2 20-second consecutive wash rinses. You're going to place on your clean over gloves. And then what do you think your first sequence is? What do we need to introduce into the environment first? The wipes, correct? The disinfectant wipes. So clean over gloves, we'll get into utility gloves, and the first part of this procedure will be getting that disinfectant wipe canister sanitized and disinfected for use for unit breakdown. Come next semester, you will find that if you have a handpiece at the unit, that would be the first part of unit breakdown that we would proceed with, but we aren't going to use handpieces this semester. So you'll see this is how you'll begin. We'll add that component in January. So clean over gloves at this point in time. Now, if you know that you were low on something in your unit, if you were low on over gloves, if you know you're low on wipes, this would be another time that you could go to Central Supply to obtain additional supplies, bring them back to your unit, put them on a paper towel, remove your over gloves, wash, put on clean over gloves, put everything away, and then get into the utility. So this is another opportunity to restock your unit if necessary. So clean over gloves on, getting utility gloves on, washing the utility gloves, 2 20 consecutive wash rinses, and then putting out 2 paper towels, one for the sanitization sequence, and then moving it to the clean paper towel for the disinfection sequence. Following the sanitization and the disinfection of the wipes canister, you will then be removing your patient treatment supplies from the environment. So they come in at the end and they go out in the beginning. So they are not involved with the heavy-duty cleaning at the unit. We want to keep those away from anything that would contact a utility glove. So 2 paper towels onto the countertop, the canister for the disinfectant wipes, and then we'll sanitize that canister for the first wipe. So you're removing your wipe, your top, your sides, your bottom, moving it to the clean paper towel, discarding the paper towel and the wipe. Again, a 2 20-second consecutive wash rinse, disinfecting the canister, and then you will remove these utility gloves in order to move to the patient treatment supply sequence. We need the wipes for the patient treatment supplies, but in order to disinfect the wipes, we have to put on the utility gloves to do that. Okay, so the first part of the sequence, sanitization and disinfection of the canister. And when Mark removes the utility gloves at this particular sequence, he won't need to use a disinfectant wipe on them because he's going to put the gloves back on within 5 to 10 minutes. So drying of the gloves, going over, obtaining the disinfectant wipe for the disinfectant process, over the top, the sides, top to bottom, the bottom, and then he'll put the canister back down on the same paper towel and discard the wipe. Washing again, and now remember, once he completes this wash, the 2 20-second wash here, he's just going to dry the gloves and place them under the sink because he's going to go back to these utility gloves momentarily once the patient treatment supplies have been removed from the environment. So when these gloves come off, he's removing the contaminated over gloves underneath, correct? Washing his hands, and then he's putting on a clean pair of over gloves to obtain the patient treatment gloves that he's going to need to place under the overgloves. You're dealing with a chemical still, you're dealing with disinfectant, so we wanna make sure that you're not touching the disinfectant solution with a single glove on. So that's why your double glove for this sequence is to protect your hands. So the overgloves are going, the utility gloves rather, are going underneath the sink. The overgloves will come off. There'll be a 2 20-second consecutive wash rinse, and then he will apply a clean pair of overgloves in order to obtain the patient treatment glove. And you'll find also, if once you're beginning the disinfection process, the breakdown sequence, if your mask is damp, you'll want to change that as well in order to ensure that you do have proper personal protective equipment. So just know that if it's damp from patient treatment, that you should also change your mask prior to beginning the unit disinfection sequence. So hands are washed, 2 20 consecutive wash rinses and dried. New overgloves are obtained, and then you're taking out patient treatment gloves, pulling off and over, placing the patient treatment on, overglove, same thing on the other hand, which means that it's going to be very important for you next week to understand what size gloves you want to have in your cabinet, and make sure that if you don't have them in your cabinet, that when you do your unit inventory, you bring them to your unit, either small, medium, or large. So overgloves, patient treatment gloves, and once he gets that combination on, he's going to put 4 paper towels on the countertop and 2 additional pair of overgloves. So on setup, it was just 1 pair in a drawer. On breakdown, it's 2 pair on the countertop. So overgloves, obtain the patient treatments, take off an over, put on a patient treatment, recover it with an over, take off the over, patient treatment, cover it with the over, and then for breakdown, 4 paper towels on the countertop and 2 pair of overgloves. And the 2 pair of overgloves will go on one of those paper towels. Then after the 2 pair of overgloves are placed on the paper towel, he's going to remove the barrier from the computer monitor, discard the barrier and the pair of overgloves he used to discard it because it's contaminated. And then he's going to put on the clean pair of overgloves. So, monitor, barrier is gone, the overgloves are gone, and now he's going to go into one of the clean pair of overgloves that's on that paper towel on the counter. At that point, he'll bring the kit up from the utility box, and he will begin the sanitization wipe of the kit. And the sanitization wipe is going to look just like the sanitization wipe in unit preparation. You're starting with the handle because it's your highest point, the receptacle in which it sits, the top of the box, the sides, the back, the front, and then the bottom in a long sweeping direction. When he's done placing it down on a clean paper towel and discarding the original paper towel and the wipe. Taking the second wipe for the disinfectant sequence, wiping the kit again. And remember also that we discussed during unit preparation that you will wear the same pair of overgloves for the sanitization and disinfection of the kit. You'll only change the overgloves when you're going from the kit to the patient treatment supply sequence. Okay, so at this point, it's been wiped twice, disinfected. He'll discard the overgloves and the wipe. So, this is going to happen, and this is a very familiar concept for all of us. Sometimes things fall. Sometimes we forget to get the things that we need. So in order to go back into the cabinet, can he just reach in with a glove and take what he wants right now? No, because he's been using disinfectant, he's been touching contaminated surfaces, correct? So in order to go get what he needs, he has to do a 220-second consecutive wash rinse, put on the new overgloves, and then get what he needs. So now we know he needs to get on the overgloves, get on the patient treatment gloves, and then if it was an overglove that fell on the floor, or he forgot to take out the extra pair of overgloves, he would have to get what he needs and then proceed with the process. So those are things that are going to happen, and they're good things for you to understand how to resolve when they do occur. Okay, so he's going to move back into overgloves and patient treatment gloves. And the other thing you really want to be sure of is that your hands are well dried. Otherwise, it's very difficult, one, to get the overgloves on, and then to get the patient treatment gloves on after you take those overs off. So you've wiped the canister and utilities, removed the utilities, and now you're working on your kit. So the kit, just like it was during unit preparation, is sanitized and disinfected. And then you'll begin with the patient treatment supplies, sanitization and disinfection. Okay, so now he's ready to go to the patient treatment supplies, correct? So he has on a clean pair of overgloves at this point, and he's going to begin with what first? What did you begin with first on preparation? The clipboard, because he wants a nice flat surface to place everything up and on. So he'll take the clipboard out, top, bottom, the clip itself, and place it on the clean paper towel on the counter. And then he will lay all of the remaining supplies after he sanitizes them on top of the clipboard. And the rationale for that is you don't want the clipboard to be the last thing coming out because you will have a pile of supplies there and the clipboard may fall on the floor. So we start with a flat surface, wipe the clipboard, and then wipe the sanitization wipe of everything from the drawer out onto the top of the clipboard. Very important that, and you'll see he's just removed the barrier on the mirror because he has to at that point in time in order to sanitize and then disinfect it. And he's going to continue wiping everything in the drawer. Very important again that pens, pencils, highlighters are wiped individually because at this point in time they're in a more highly contaminated environment than they were initially. Okay, we've used them for patient treatment. So everything is being wiped, placed right up on that clipboard. Be sure that you really look into the drawers and that you remember what drawers you have placed things in so that you ensure that you have taken everything out of the drawers and sanitized and disinfected them. Because oftentimes what happens is when we go to then disinfect, sanitize, and disinfect the unit, there's still pencils rolling around and things were forgotten in drawers. So you want to ensure that you look in both drawers, and when Mark organized the drawers, he moved the stethoscope and the sphygmomanometer down to the next drawer. You want to ensure that you're checking those, that after you're wiping them, that you're placing everything up on top of that clipboard, and when you're done, you'll take a final look to make sure that they are in fact out of the drawers. Once he has completed the sanitization wipe, he's going to discard the sanitization wipe or the disinfectant wipe that he used to sanitize these supplies with, and then he's going to begin the disinfection sequence with a second wipe. And once that sequence begins, and you'll see he's discarding the paper towels that are in the drawer at this point in time, and making sure that when he places the things on the countertop that they're secure. So a second wipe, he's going to open the kit, and now as he is going through the disinfection sequence, he's wiping them and moving them from the countertop into the protection of that tackle box. Okay, so again, everything individually. Top to bottom, you have some groove tops on things that are more difficult to get to. You want to make sure that you take your time and that you're going through those thoroughly. So once this is disinfected, you'll see that the sphygmomanometer will be placed back inside the case in which it belongs so that it's protected, we don't lose pieces from it. So whatever has been taken out of something will be placed back into that container prior to sanitization, post-disinfection, in order to be protected. So goggles, and if you wear glasses, you might have 2 pair of goggles in the drawer. You're wiping both of those. You're wiping the floss dispenser, your oral self-care bag, your stethoscope, all your pens and pencils, highlighters. Everything that you brought out of the kit has to be sanitized and disinfected to be placed back into the kit. These are non-sterilizable items, okay, so they must be disinfected. The oral self-care bag that you need to make sure your name is on in permanent marker for Monday. And that's going to be kept closed in that Ziploc bag inside the kit, your bib clip, the patient handheld mirror, and then you're going to lock up your kit, and the last item that you will disinfect will be your clipboard. It's very important that you securely fasten that latch on that tackle box, because if you don't, when you pick it up, it's going to open, and all of your items may fall to the floor. So the final item to be wiped is the clipboard. And then Mark is going to take this back to the designated area, be it the dental materials lab or the private treatment room. He's going to remove the barrier from the monitor and discard it, along with the patient treatments and overs. Do a 220 consecutive wash, rinse, get into new over gloves, and then get back into the utility gloves. And that's why you did not have to use a disinfectant wipe on those utility gloves, because they weren't going to sit long enough for it to really have an effect. So back from taking the treatment supplies, he's going to remove the monitor barrier, and then he's going to remove his gloves, both pair, and do a 220-second consecutive wash, rinse. When you think about unit breakdown, it really becomes a very logical sequence. So rather than having to memorize every step, you have to think about what has to happen in a logical manner. One, I can't wipe anything down unless I sanitize and disinfect a canister. Two, I don't want to touch those patient treatment supplies with utility gloves, so I need to remove those from the environment as safely as possible. Then I need to get back into my utility gloves to begin the heavy-duty cleaning of the unit. So what he's going to remove next, he's going to put on clean over gloves. And remember we mentioned that we don't ever like to keep that monitor exposed. So what's going to happen is he's going to put on new over gloves, obtain a chair protector, and cover the monitor with that barrier. Into the utility gloves, and then start to think about the instruments, because we can't do anything else till the instruments have left the area. I can't wipe a unit, because what do I have all over it?
Instruments.
Barriers, right? Barriers and instruments. And I can't remove the instrument, I can't remove the barriers till I remove the instruments. So clean over gloves now, barrier back over the monitor, and then utility gloves back on with a 220-second consecutive wash rinse. So utilities, a barrier over the monitor, a barrier over the monitor. Okay, so clean over gloves, a clean barrier, back into utilities. A 220-second consecutive wash rinse because the gloves have been under the sink. Okay, more of a contaminated area. They need to be washed, and then we would remove the instruments in the biohazardous waste bag. So let's talk about that a little bit. Your biohazardous waste bag is going to be highly contaminated, saliva, blood-soaked type items. You may not have much biohazardous waste this semester, but when you take your instruments in, you're also going to remove the biohazardous waste bag. If there is no biohazardous waste in it, it will be discarded in regular waste. If it is regulated waste, then it will go into the biohazardous waste bin that we will show you in the central sterilization area. There's a cabinet on the right with a red label on it, and there's a red bag in the cabinet, and that's where that waste will be disposed of. The instruments today, the cassette was not open. So we're going to bring that cassette in and show you how you would manage a cassette that was unopened. We can't put it back in the cabinet, but it wasn't utilized, so something has to happen with it to allow me to get it back into the cabinet. So what we're going to do is re-sterilize it without opening it. We'll put new tape on the back of it and a new date. We'll put new pieces of tape, indicator tape on either end, and we'll put the number of the cassette there so that we know the cassette needs to be rerun, but that it was not open. If the cassette were open, we would take out all the disposables in it, the gauze, the indicator strip, close it, lock it, cover it right back up with that blue IMS wrap, and bring it into Central Supply to go through the sterilization process. So let's all head to Central Supply. So here's the biohazardous waste area right here on the right. You have your biohazardous waste label on the outside of the cabinet and a red bag inside. And Mark is now going to place 3 new pieces of indicator tape on this unopened cassette. 1 on the back for a new date, 2 on either end with the cassette number on it, so that we know that this needs to be re-sterilized and that we should not be using it unless that indicator tape has changed color to a dark charcoal gray or black. If we needed to completely work it through the instrument maintenance system, remember that your dirty counter is over there on the right. You would get things into the ultrasonic, run for 16 minutes into the sink, rinse them, drain them, blot them dry, repackage your disposables, wrap them, and identify them and place them on top of the magnet plate to be sterilized. Remember that in here you have all of your cassettes that these will be placed back into once they're sterilized, but you're obtaining everything you need from the outside cabinet. All right, let's head back out. So you're returning from Central Supply, and Mark has been holding on to contaminated instruments, and even if they were unopened, they were in a contaminated environment, and he was in Central Supply, so what does he have to do?
Wash.
Has to wash. So he has a 2-20-second consecutive wash, rinse, and then when he's through with that, he now needs to do what? What's next?
Put the barrier thing on.
Right, I can't do anything else until I remove the barriers. So he's going to start more up on the top of the unit and work his way down and around and remove all of the barriers that were placed on the unit. Typically what we do is remove one of the larger barriers, one of the chair protectors, and then just kind of push everything else into it and even adhere the barrier wrap to it, so that when we're through, we just will compact it into a smaller ball and push it down into the garbage. Otherwise, your garbage can is overflowing with barrier wrap and nothing else will fit into it. So you'll see as he begins to remove the barriers that he will compact everything and get it into a much smaller size. So the barrier off the air water syringe so that the barrier can come off the bracket tray. And then you'll have your light handle barriers, your light switch barriers. Remember that we removed the biohazardous waste bag and that barrier already. And we removed everything that had to do with the computer already. So all the paddles on the operator's stool will be removed. And then he'll work his way around the unit, taking the back of the chair protector off, the sides of the chair arms on each side. The plastic sleeves over the evacuation hoses, the barrier wraps over the cuspidor and drinking cup buttons and over the portal of the ultrasonic. Off the paddle on the assistant stool, and then off any of the soap dispensers over at the sink. So see how he's made a much more compact situation there with the barrier wraps, and then as he puts them into the garbage, with utility gloves on, he's going to push them down to compact that garbage a little bit. So all the barriers now are being removed, and after he removes the barriers, he's going to elevate the unit to its highest point in order to flush the line. So you're remembering that you have 3 water lines. You have a water syringe, a cuspidor, and a drinking cup button, and you're going to run them for 1 minute. Again, moving everything through the lines, clearing the lines out. So that's a 1-minute sequence. When he's through running those lines, and remember you're depressing the button on the air water syringe that has the little water droplet above it. The other button has a cloud, and that's for air. So you want to make sure that you're depressing the water button, and that you're also depressing the cuspidor and the drinking cup button as regularly as you need to in order for them to run continuously. Once he's through with that, he's going to take the high-speed evacuation and suction out the cuspidor around the trap, and he's going to lift the trap up, suction out the bottom of the trap and into the receptacle in order to get anything in there that we may not want to be moving around when we're actually wiping it in just a bit. Polishing, fluoride, scaling and loop cleaning oftentimes leave things in a cuspidor that it's best to get out this way. So once that suction has been complete, a 2-20-second consecutive wash rinse. And then you would begin the sanitization process and then the disinfection process wipe of the unit. Okay? So at this point, that's when you begin the wiping of the tops, the wiping of the bottoms for sanitization, the washing, and then repeating for the disinfection sequence. So we're not going to do that right now because we've just gone through that, but that's how that will look. Exactly as it does when you prepare a unit is exactly how it looks when you break down the unit for that wipe sequence. So let's fast forward through that and get to the point where Mark would be finishing the second wipe of the base of the unit. So the disinfection of the bases has just been completed. So he would perform a 220 consecutive wash rinse, correct? And then what has to happen to that canister of disinfectant wipes? It has to be sanitized and disinfected before we can place it again back at the sink. So at the end of the day, after you have sanitized and disinfected the unit, you would wash, you would place a clean paper towel on the counter, and then perform your sanitization wipe, move it to the clean paper towel, wash, the disinfection wipe, and then place the canister back at the sink. So sanitization wipe of the top, the sides, and the bottom. Discard, wash, and then the disinfection wipe. And immediately following that, that canister will be placed at the sink. Okay, paper towel discarded, and then you will begin the process of unit realignment. And remember that unit has to be realigned for several reasons. One, it allows the clinic to remain professional looking. Two, safety, so that cords are not dangling on the floor. And three, ease of maintenance, so that the facility can be cared for properly. So after this second wipe, and our second rinse rather, there'll be a second wipe of the container. Container will be placed at the sink, and then we'll begin unit realignment. Ensuring also that as you're aligning, you're realigning from top to bottom, and that you're turning off the master switch so that we ensure that there aren't any water leaks, etc. overnight when no one's in the building, and we're not using unnecessary power. So disinfect the canister back to the sink, and then unit realignment. He's getting very good at that, isn't he? Okay, so discarding the wipe, discarding the paper towel, and then unit realignment. So 2 paper towels, one in your hand to keep between your utility glove and the unit in order to keep the unit clean. One on the chair to put the rheostat on when we get to that point. So you're bringing the light in, the bracket tray will come in first, about 6 inches off the chair with the cords, the light about 6 inches over that, master is turned off, the back of the chair is placed away from the wall so as not to scratch the wall. The same thing on the other side. If the ultrasonic and the cuspidor and the bracket arm were out of alignment, they would be straightened out. And then the rheostat would be picked up and placed on top of the paper towel on the unit, and then the foot pedal would also be picked up and placed there. And we would also make sure that that chair arm was also up in position. So the unit has been realigned. We're looking around to make sure that there aren't any papers, paper towels, etc. We're going to discard those, make sure cabinets are closed, drawers are closed, and then the last thing that we're going to do to this unit is run something through the evacuation hoses called Sani-Treet. And Sani-Treet contains enzymes that will allow the lines to be flushed properly and to not accumulate things that would clog the line. So we would take the Sani-Treet jugs, are run at the end of the day. So you will be running Sani-Treet on this side at the end of the day because the evening clinic will run it on the other side later. but you're the end of the day on this side. So you'll take a Sani-Treet jug. They are located under every other unit out on the clinic floor. So units 4 and 5 share this gallon jug. So you're taking the high-speed evacuation, turning it on, the slow-speed evacuation, turning it on, and fitting it over the size receptacles that match with the size of the evacuation hose. A quart will run through the slow piece, a quart will run through the high speed, till you get down to half a gallon. Once you've reached that half a gallon point, you'll remove the hoses, turn them off, and use 2 cotton swabs that Mark has taken from the sterilization pouch that were in the handle of the jug. Notice that before he started to run it, he also popped the top open on the jug so it did not collapse the jug inward, so it will run properly and have the proper amount of air it needs. When he's through with half a gallon, he'll turn them off and he'll take a cotton swab and clean out the inside of each one of those hoses with a clean cotton swab, a sterile swab. So you're at a half a gallon, you're turning them off because if you don't, the suction will draw the cotton swab in. He'll remove them, and then with an individual cotton swab for each, he'll reach down into the inside and clean it. And when he's through with that swab, he'll place it onto that paper towel to be brought into biohazardous waste when he's done. So one into the high-speed evacuation, and then the slow-speed evacuation comes apart. So you'll go down into the center of it and clean it, and then you'll snap it apart. You'll clean the inside of each one of those pieces, snap it back together, reseat it, and then take those cotton swabs into biohazardous waste. The remaining half jug would belong to unit number 4, and you would move it right over there to run the Sani-Treet through that line if the person at that unit was ready to have that happen. You would also place the other 2 cotton swabs back in the handle of that jug to be used at that unit. These cotton swabs are going to go into biohazardous waste. Okay, so you would bring them in, you would discard them, you would come back, and obviously you would wash 2 20-second consecutive wash rinses. Now, at the end of the day, if the person at the other unit used the remaining Sani-Treet, if there was any residual in the bottom, say there would not be that much. Say there was something like this in the bottom. You would discard it, and you would leave the top open and place it back underneath the cabinet, under the sink, so that it would allow it to dry properly. So Mark is coming back from Central Supply, biohazardous waste. He's going to perform 2 20-second consecutive wash rinses. Questions on that at all? So now unit breakdown is complete. And in a minute, we're going to get out of our garb. But let's talk about what happens after you complete your unit. Once you complete your unit, then you're going to